Dr. Sheetal, consultant gynecologist at Cloudnine Hospital, Punjabi, Bagh. Friends, once you start your journey of pregnancy, you would be visiting your doctor for evaluation of your baby and your follow-up visits. At certain visits, your doctor would be suggesting you certain prenatal tests. Now, those tests are done to rule out chromosomal abnormalities of your baby. First of all, you need to understand what are chromosomes. Chromosomes are thread-like structures which are present in each cell of our body and due to which we are similar to each other and we are different from each other as well. Friends, what happens is that these chromosomes are arranged in 23 pairs in human being, and for each cell we get one copy from the father and one copy from the mother. And when the fertilization of sperm and egg is happening, there might be certain situations in which a pair might have an extra copy of the chromosome, those are called trisomies, or one copy might be deleted, that is monosomy, and there might be certain deletions or duplications of the chromosome. Now, we don't want our children to have such chromosomal abnormalities because those babies are born with mental retardation. They may have defects of heart, kidney, brain. So we want to avoid having such a pregnancy. Now, although we can't treat the chromosomal abnormalities, but we can certainly evaluate you. Now, in our evaluation, ideally the cells of the baby should be extracted and we should do the entire chromosome screening or testing. But it is not possible to extract the cell of the babies. So we do the screening test. In those screening tests, there are certain ultrasound and blood tests at the end of your first trimester, that would be at the end of the 3rd month, and there are certain tests at the end of your 5th month. Friends, let us now understand what are the tests which would be offered by a gynecologist. The prenatal tests at the end of the first trimester are the ultrasound obstetrics, that's the NT&B scan. Now this test is done between 11 to 13 plus 6 weeks. And what happens is that we check the nasal bone and the nuchal translucency of the baby. And in addition to that, there are certain other parameters which are evaluated. In addition to these, there are certain other parameters which are evaluated by your radiologist. And once the radiologist, the ultrasound doctor releases the report, we are able to assure ourselves that the baby is doing fine and the baby has been evaluated. The second test, which is done simultaneously, is the double marker or the dual test. This test is also done at the same time and certain ultrasound parameters are incorporated in the report. The 2 chemicals of beta-HCG and PAPI are evaluated in the test, and what happens is that the software gives us a report of the low risk or the high risk of certain chromosomal abnormalities. If somebody has a high risk situation, we evaluate further, and if it is a low risk situation, we are assured that the baby is doing fine. The other set of investigations which are done at the 5th month are the level 2 ultrasound, which is the anomaly scan. Now, this is one of the most important ultrasounds of pregnancy. We evaluate the baby from head to toe, and there is a certain protocol which is followed by every radiologist in this evaluation. And once they tell us that there are no congenital anomalies in the baby, we again are reassured. The other test which might be offered by your gynecologist would be the quadruple marker. The quadruple marker is done between 15 to 20 weeks and the level 2 is done between 18 to 22 weeks. And in the quadruple marker, again, the certain chemicals are evaluated and the low risk or the high risk situation is assured to us. Now, if you actually get all the 4 tests done, then we believe that there is almost 95% sensitivity that we are not missing any major malformation or congenital anomaly or chromosomal abnormality in the baby. Apart from these, friends, your gynecologist might offer you NIPT, that is the non-invasive prenatal testing. This is the test in which your blood sample is drawn, and we believe that certain cell-free DNA of your baby is also present in your blood. That DNA is extracted and your baby is evaluated for the chromosomal abnormalities of 5 chromosomes, 13, 18, 21, X and Y. Now, once that test is done, it offers us a sensitivity of almost 99% to rule out the chromosomal abnormalities in these 5 chromosomes. Now, after doing these tests, if your gynecologist tells you that these tests are normal, so rest assured your baby is doing fine and you don't need any further evaluation. In case in these tests, among these tests, there is certain problem, then your gynecologist would be offering you the post-test counseling, And you might be advised certain tests like CVS or amniocentesis. Now, these are the more confirmatory tests if we want to rule out the chromosomal abnormalities of the baby. But as far as the screening tests are concerned, the first four are considered a vital part of the screening method. I hope the information was useful for you. Happy parenting. Thank you.